Imagine a world crisis where the referee suddenly leaves the field. The rules are still there, but who will enforce them, and whose interests will they protect? That's exactly what's happening right now at the heart of global health. The World Health Organization, the body meant to coordinate and defend us against pandemics, is suddenly running out of cash. The United States, once its biggest backer, has walked away, leaving a $600 million hole. And just as the world's attention is starting to wander, China steps forward, offering $500 million and a promise to keep the lights on. But what does China want in return? Welcome to a new battleground, not of missiles, but of money, influence, and decisions that might affect every person on Earth. As global health teeters on a financial knife edge, one question pulses beneath the headlines. Who is really calling the shots now, and at what price? To answer that, we need to rewind. What exactly is the World Health Organization, and how did it become so dependent on the whims of its most powerful members? The WHO was born in a different era. After the devastation of World War II, the United Nations created a special agency, setting out an ambitious goal, the highest possible level of health for all people. Its headquarters sit in Geneva, Switzerland, neutral territory, a symbol of multilateral cooperation at its best, or at least its most idealistic. For decades, the WHO has battled everything from malaria to polio to Ebola, coordinating responses, sharing research, and, crucially, setting the technical norms that decide what counts as a pandemic, or when travel restrictions might save lives. It's a central hub for everything from disease surveillance to setting vaccine recommendations. But the money that funds this global mission, that's a story of politics as much as science. The WHO's budget comes from two main sources: mandatory contributions from its 194 member countries, and voluntary contributions, extra money that nations, foundations, or corporations choose to donate for specific projects. Over time, the voluntary share has ballooned, now making up nearly 80% of the total budget. The biggest player, for decades, was the United States. Washington's dollars paid for disease surveillance, emergency responses, even much of the global polio fight. Then, in 2020, as COVID-19 raged, the calculus changed. The Trump administration, unhappy with what it saw as missteps and alleged bias within the WHO, especially towards China, announced a dramatic exit. The world watched as the U.S. withdrew, yanking hundreds of millions of dollars away. Christophe Ben, director of global health diplomacy at the Joap Lang Institute, summed up the sudden shock. The U.S. has some of the most sophisticated systems of health expertise in the world. They will be sorely missed. The financial aftershock rippled far beyond Geneva. The American withdrawal left a $600 million hole in the WHO's proposed 2025 budget, a shortfall so severe that the organization slashed its 2026-2027 spend by 22%, shrank its staff by about 15%, and even halved its own leadership team. Ambitious projects like the Global Polio Eradication Initiative now face a 20% funding cut, threatening decades of painstaking progress. But it's not just about money. The U.S. retreat created a power vacuum, and it didn't last long. In May 2024, during the 78th World Health Assembly in Geneva, China's Vice Premier Liu Guozhang pledged $500 million over 5 years, stepping into the spotlight as the WHO's new biggest state donor. With the cameras flashing and delegates taking notes, Liu declared, "The world is now facing the impacts of unilateralism and power politics, bringing major challenges to global health security." The message was clear. China was not just filling a budget gap. It was seizing the chance to steer the conversation, and perhaps, some would argue, the policies. It's hard to overstate what a tectonic shift this is. For decades, global health has been quietly but firmly shaped by Western priorities: U.S. research, European funding, global North agendas. Now, for the first time, the world's leading health body is relying on a new superpower, one with a very different track record on transparency, data, and global influence. People are asking, what does this mean for global health priorities? Are we simply swapping one influence for another, or is something deeper at stake? To understand the stakes, we need to look at how WHO funding actually works. Unlike its UN cousin, the World Bank, which can lend money and manage huge financial flows, the WHO can only spend what it's given. Its mandatory fees, set by a formula based on a country's wealth and population, only cover about 20% of the budget. The rest comes from voluntary donations, often earmarked for specific diseases or projects. That gives enormous sway to whoever signs the biggest checks. China's $500 million pledge, laudable on paper, is still short of the gap left by the US. And the strings attached? Those will become clear over time. Historically, donors have steered WHO priorities, subtly or overtly. Want more money for malaria? Convince the biggest donors it's worth fighting. Want to emphasize vaccine R&D or surveillance in a specific region? The money often talks louder than the scientists. The potential risks are not theoretical. In recent years, concerns about Chinese influence in other international bodies have surfaced, from trade to telecommunications. Now health is in the spotlight, as Tedros Adhanom Ghebreyesus, WHO's own Director General, put it. The agreement is a victory for public health, science, and multilateral action. But beneath the diplomatic language, there are worries about independence. International law expert Gianluca Berci cautions, the pandemic accord is a step forward, but its success hinges on equitable access to countermeasures. Translation: if new sources of funding come with conditions, who gets vaccines, drugs, or data in a future pandemic could look very different. At the same time, the WHO is trying to diversify. Facing the shortfall, member nations have agreed to increase mandatory contributions by 20% over the next 2 years. But even that bump won't close the gap. Some insiders hope European countries or private philanthropies might step up. But with competing domestic priorities, few are rushing to fill America's shoes. The internal consequences are also dramatic. Cutting staff means less technical expertise, fewer people to hunt down disease outbreaks, to advise countries, or to coordinate emergency responses. Projects that once seemed unstoppable, like eradicating polio, now face the real risk of stalling out or even sliding backward as money dries up. Increased funding and collaboration are crucial to accelerate vaccine development and ensure global access during pandemics, warns Richard Hatchett, CEO of CEPI. And there's a subtler but possibly more dangerous risk. As funding becomes more politicized, the WHO's core purpose as a neutral, science-based body comes under threat. Every donor wants a say in how their money is used. What if priorities shift from the world's most urgent health needs to those that align with a particular superpower's foreign policy? Already some are asking, will WHO push more resources into areas that support China's Belt and Road Initiative? Will it be as vocal on issues like data transparency or biosecurity, where China's own record is contentious? Or will the organization bend, ever so slightly, in ways that only become clear when the next emergency hits? Meanwhile, the world faces immediate risks. The pandemic accord, a new framework for data sharing and how vaccines or treatments are distributed during emergencies, is up for adoption. But as Sueri Moon, co-director of the Global Health Center in Geneva, notes, the PABS system within the pandemic accord faces challenges in balancing data sharing and equitable access. Without strong, independent leadership at the WHO, can the world really trust that future decisions will be fair and fast enough when it counts? In the corridors of Geneva, the mood is tense. Some see opportunity. Finally, a chance to fix a broken funding system, push for true multilateral action, and welcome new voices. Others see a slow drift into fragmentation, where member states, frustrated by politics, take their money and expertise elsewhere, leaving the world more vulnerable than ever. We're left with a simple but profound question. As China steps in where America stepped out, is the WHO becoming stronger or simply shifting from one sphere of influence to another? And what might this mean for the next global health emergency, when lives, not just politics, are on the line? Just as the world starts to adapt to this new reality, another challenge emerges. If the money keeps shifting and the rules change with each new donor, can the WHO remain the world's health referee, or will it become just another pawn in the global power game? In the next part, we'll dive deeper into the tug-of-war between independence and influence, explore the real-world impacts on public health, and reveal what's being done, behind closed doors, to shape the future of global disease control. But what does the future hold for the World Health Organization and for global public health, now that the landscape of power and influence is shifting so dramatically? Let's fast forward. With the United States having stepped back and China stepping forward, the WHO sits at a crossroads, its path shaped by politics as much as by science. First, let's imagine a scenario in which China's new role as the top donor shapes the WHO's priorities. International observers are already wondering, will the focus of major WHO initiatives quietly shift toward issues that align with Beijing's interests? For instance, could infectious disease control, vaccine distribution, or even global health policy recommendations be subtly nuanced in ways that benefit Chinese health diplomacy or economic goals? Expert Sueri Moon warns, the PABS system within the pandemic accord faces challenges in balancing data sharing and equitable access. In practice, this means that who holds the purse strings might indirectly shape everything from how pandemic data is shared to which countries get priority access to vaccines. Meanwhile, the organization's already stretched budget is feeling the squeeze. The WHO has cut funding for key programs, including staff layoffs and a possible 20% reduction to the Global Polio Eradication Initiative. These aren't just numbers, they're lives and futures at stake. Christoph Benn notes, the U.S. has some of the most sophisticated systems of health expertise in the world. They will be sorely missed. Without global superpowers pulling together, can the world's only truly universal health agency remain a neutral referee? Now consider the counterweight scenario. Alarmed by China's growing sway, other major economies, maybe the European Union, Japan, or even a returning U.S., could step up their financial commitments. A more diversified funding base would be a lifeline for the WHO's independence, letting it balance donor interests and stick to science-driven priorities. But that requires trust, transparency, and political will, all in short supply in a fragmented world. What if the funding gap is not filled and consensus collapses? The specter of fragmentation looms large. Some member states, disillusioned by politicized priorities or sluggish reforms, might start seeking alternative alliances or agencies for health cooperation. The WHO's unique power is its ability to unite every nation under one roof. But if the organization loses credibility or simply can't pay the bills, it risks irrelevance. As Gianluca Burci puts it, the pandemic accord is a step forward, but its success hinges on equitable access to countermeasures. If access is skewed or trust erodes, the world could face a future of divided, less effective responses to global health threats. Yet, within this uncertainty, there are also real opportunities. The current crisis could be a powerful wake-up call. The push to boost mandatory member contributions by 20% over the next 2 years, even if not enough by itself, signals a growing acknowledgement that health security is a collective good. Stronger international governance could help the WHO withstand outside pressures and ensure that donor influence never outweighs scientific evidence. Now let's bring this home. Why should you care about the internal politics of faraway institutions? The reality is, when the WHO is strong, everyone benefits, from faster pandemic containment to safer food standards and life-saving vaccines. But when it's weak, outbreaks spread farther and faster, medicines take longer to reach those who need them most, and fragile health systems around the world suffer. This story isn't just about numbers and politics. It's about the invisible web that connects your health to every part of the globe. The COVID-19 pandemic showed us how a cough in one country can become chaos for us all. Whether the WHO is truly able to act as an unbiased referee in the next crisis could determine not just how quickly a virus is contained, but whose lives are saved. So what lessons can we draw from this new era? First, vigilance. We, as global citizens, need to pay attention to how international organizations like the WHO are funded and governed. The more we know, the more we can pressure elected leaders to support science, independence, and global collaboration, not just narrow national interests. Second, advocacy. Whether you're a healthcare worker, scientist, or simply an interested citizen, your voice can matter. By supporting independent journalism and demanding accountability from our governments, we keep the spotlight on global health as a priority. Third, resilience. Health crises are inevitable, but their impact is not. By building alliances across countries, sectors, and communities, we can help create the political will to strengthen organizations like the WHO, so they're ready for the next pandemic, whatever form it takes. Remember, many of the world's greatest health victories, eradicating smallpox, pushing polio to the brink of extinction, battling Ebola, were only possible because countries pooled resources and trusted science over politics. If funding shortfalls and power struggles cripple that spirit, the cost will be measured in billions of lives and trillions of dollars. As we wrap up, let's return to our key question. Can the WHO remain a neutral, effective global health leader in an era of shifting donor power? The truth is, the risk of bias grows whenever any single donor becomes too dominant. But, as Director General Tedros Adhanom Ghebreyesus recently emphasized, the agreement is a victory for public health, science, and multilateral action. The future of the WHO does not depend on any one nation, but on the willingness of all members to share responsibility and safeguard its independence. And here's a secret that rarely makes headlines. Even at the height of political wrangling, much of the real work of global health, the surveillance, the emergency response teams, the data sharing, still happens quietly and collaboratively behind the scenes. Scientists from rival nations, doctors from distant continents, and local health workers continue to risk everything, working together for a common cause. The headline battles are real, but so is the daily unsung cooperation that keeps pandemics at bay. So, what can you do right now? Stay informed. Support global health programs. Urge your governments to prioritize not just national health security, but international health solidarity. Share this video with friends and family so more people understand what's at stake. Because in our interconnected world, the health of one is the health of all. Thanks for watching. If you found this video insightful, hit like and subscribe for more deep dives into the forces shaping our future. Got questions or thoughts about the future of global health? Drop a comment below. We want to hear from you.